Let's learn to give CPR to a child. It's not hard to do. To do CPR, you simply perform repeating cycles of chest compressions and rescue breaths. We'll learn those separately, and then when you're ready, we'll put them together to do CPR. You'll need a child CPR mannequin and a CPR mask to practice. Be sure to get those before moving to the next segment. Welcome back. We're going to practice doing chest compressions. Kneel close to your mannequin, near the chest. You'll be using a single hand to do the compressions. Put the heel of your hand on the lower half of the breastbone. Bring your shoulder up above your hand and lock your elbow. Ready? Let's push with the beat. Here we go. Push hard, at least 1/3 the depth of the chest, or about 2 inches. Push fast, at least 100 times a minute. Allow the chest to fully rebound. You're doing great. Keep your arms straight and use your upper body weight to push. Okay, stop. Let's do a set of 30 compressions from the start. Do them with me. Are you ready? Find your hand position. Let's start. "25, 26, 27, 28, 29, 30. Great! If you need more practice with compressions, just play this section over again. Now let's practice giving rescue breaths. Kneel next to the head of your mannequin. Look at your CPR mask to make sure the one-way valve is inserted. Place the mask over the nose and mouth. Put your thumb and forefinger along the top of the mask. Hook the bony ridge of the jaw with your fingers of the other hand and use your thumb on the bottom of the mask. Tilt the head and lift the chin. This brings the face up into the mask, creates an airtight seal, and opens the airway. Take a breath and blow through the valve opening. Each breath is 1 second in length and only has enough air to create a visible rise of the chest. See? No more than that, okay? Now let's practice giving 2 breaths at a time. Be sure to come up off the mouthpiece and take a fresh breath in between them. Ready? Do it with me. Let's try again. You're doing great. Now let's do a series of 2-breath sets. If you're still having problems getting chest rise, work on adjusting things to get it. Ready? Here we go. Try not to overventilate. Be consistent. Excellent. One more set. Nicely done. If you need more practice, just play this section again. Are you ready to put it all together and perform CPR? Great. First, we need to go over the steps of checking the child to see if he needs CPR. Before checking, always make sure it is safe for you to be there. If a child appears unresponsive, tap or squeeze the shoulder and ask loudly, "Are you okay?"
Are you okay?
If the child is unresponsive,
activate EMS.
have another person activate EMS. Quickly check for breathing by looking at the face and chest. If the child is not breathing or just gasping, you need to perform CPR. Let's try the assessment steps together. Are you ready?
Are you okay? Activate EMS.
He's not breathing, and CPR is the way to care for him. To perform CPR, all you do is repeat cycles of 30 compressions and 2 rescue breaths. Let's put it all together now. We'll check first to see if CPR is needed, and then we'll provide 2 minutes of compressions and breaths. That's 5 cycles of 30 and 2. If you get tired, it's okay. Rest a bit and play this section over again.
Are you okay? Activate EMS.
Congratulations, you now know how to perform CPR on a child.